Hello, good day, Professor. Today we are going to perform a return demonstration in the proper positioning and draping of the patient. But first, let me introduce ourselves. I am Doreen Nicole Sanchez,
And I'm Chacha Sisipuma,
and we are the nursing student of Mary Child's College, Level 1, Section D. So, before we start, let me first introduce you the purpose of positioning and draping. So, we all know that the purpose of proper positioning and draping is to maintain the patient's airway and circulation throughout the procedure. It also prevents nerve damage, allow the surgeon or the health provider to access stability to the surgical site as well as for anesthetic administration.
and for draping, it's to maximize the patient's comfort and dignity.
Before we start for the procedure, first is we have to ensure that all the equipments that we will be using is complete, such as the mask, gloves, bed film with proper overhead lighting or bedside lighting, chair for examiner, blanket, client's gown or patient gown. So prior to the performing the procedure, introduce self and verify the client's identity using two identifiers. Explain to the client what you are going to do, why it is necessary to position him or her, discuss how result will be used in planning future care treatment. Next is to perform hand hygiene and wear gloves if necessary. Wear mask, face shield or goggles also if it is necessary. Close the curtain or door to provide clients privacy. Encourage client to assist as much as possible. Get adequate help. Use mechanical aids.
Draping and positioning. Draping should be arranged so that the areas to be exposed and other body areas are covered. Drapes are made up of paper, cloth, or bed linen, provide warmth.
For the first position, supine or horizontal recumbent. Clients lie down with the legs together on the examination table or bed in home setting. Small pillow in the head to promote comfort. Areas assessed: head, neck, axillae, anterior thorax, lungs, breast, heart, abdomen, all extremities, peripheral pulses, and vital signs. Cautions: tolerated poorly by clients with cardiovascular problems and respiratory problems. Next is dorsal recumbent position. The client lies on the examination table or bed. Knee bent, legs are separated, and feet flat on the table or bed. Small pillows under the head. Areas assessed: head, neck, chest, axillae, lungs, heart, extremities, breast, and peripheral pulses. Female genitalia rectum and reproductive tract. Cautions: may be contraindicated for clients who have cardiopulmonary problems. The abdomen should not be assessed because the abdominal muscles are contracted on this.
Dichotomy position. The client lies on his or her back with the hips at the edge of the examination table. Feet supported in stirrups. Areas assessed: female genitalia, rectum, and female reproductive tract. Cautions: may be uncomfortable and tiring for elderly, so they cannot assume this position. Best to keep the client will drape during the examination and to perform the examination as quickly as possible. Lateral or sideline position. A lateral recumbent position in which the individual rests on the right or left side, usually with the knees slightly flexed. A pillow is often placed in between the legs for patient comfort. Body weight distribution. In this position, most of the body weight is distributed to the lateral aspect of the lower scapula, the lateral aspect of the ilium, and greater trochanter of the femur. Relieve pressure on the sacrum and heels. Lateral position helps relieve pressure on the sacrum and heels, especially for people who sit or are confined to bed rest. Sims position. Client lies on her right or left side with the lower arms placed behind the body. Upper arm flexed at the shoulder and elbow. The lower leg is slightly flexed at the knee, while the upper leg is flexed at a sharper angle and pulled forward. Areas to assess: rectal and vaginal areas. Caution: clients with joint problems and elderly may have some difficulty assuming and maintaining this. Prone position. Client lies down on his or her abdomen with head turned to the side, with or without pillows. Area assess. Used primarily to assess the hip joint, posterior thorax, and the back of the client. Cautions. Often not tolerated by elders and people with cardiovascular and respiratory problems. Knee chest position. The client kneels on the examination table with the weight of the body supported by the chest and knees. A 90-degree angle should exist between the body and the hips. The arms are placed above the head with the head turned to the one side. A small pillow may be used to provide comfort. Areas assessed. Knee chest is useful for examining the rectum. Caution. Elderly client with respiratory and cardiac problems may be unable to tolerate this position. Fowler's position or semi-setting position. Head and trunk are raised 15 to 45, low semi-Fowler's position to high Fowler's position to 90 degrees. Knees may or may not be flexed.
Our top neck position. Client sits either in the bed or side of the bed with overbed table across the lap. Areas to assess. This position is helpful to clients who have problem exhaling because they can press the lower part of the chest against the edge of the overhead table.
Sitting position. Sit upright on the side of the examination table, edge of chair or bed in office or home setting. Areas assessed. Head, neck, posterior and anterior thorax, lungs, breast, axillae, heart, upper and lower extremities, and vital signs. Caution. Elders and weak clients may require support, or others can tolerate long arcs of position may change to supine or other positions. Standing position. Clients stand still in normal, comfortable resting posture used in examining the male genitalia. After the procedure, return the patient to comfortable position. Offer assistance whatever needs of the client that may arise. Side rails up for safety. Thanks the client for her or his cooperation and give the place the call bell near the client. Thanks the client for her or his cooperation and
Gather all the equipment and dispose of disposable supplies that was used. Remove face shield or goggles. Retain the mask. Remove gloves and perform a proper hand hygiene. Document all the relevant information, time of physical assessment, change of position, noting the following: any signs of pressure areas, use of support devices.